Welcome back to the True Sports Physical Therapy Podcast. We got Dr. Justin Lugtu with us today. I'm so excited to have you here and learn about how you rose to clinic director within Spear. Let's start by just telling us about Spear Physical Therapy. I know they're located up in New York, but tell us about what makes Spear special, and make sure you just hit on some of the culture and what it is that keeps you engaged coming to work every day.
Of course. First of all, happy to be here. Thank you, Yodi, for having me. So, yes, I've been at Spear for 3 years now. And what I can say is, I think the thing that makes us different is we think of ourselves as a customer service company that happens to do physical therapy. So everything we do, patient first, team first. The culture is very, say, local. Across the board, we all have that customer service mindset. It's the person in front of you that is your priority. And each clinic, I would say at its own level, has its own level of fun. I would say what we do on a day-to-day basis is fun. Our priority is to have fun as a team, treat our patients well, and have that customer service mindset at all times.
Dude, that's a beautiful mission, and that's an awesome culture. Just by way of backstory, I know the CEO of Spear for a long time. He gave me a huge break when he graciously allowed me to tag along with Team Israel for the World Baseball Classic. And from that point on, at every turn, his name's Dan Rutenberg, he has shown himself to be an outstanding human, a mensch, as we call it in our family. And he's been a great leader. Now, I was just walking around New York on a food tour with my dear buddy, because it is the mecca of kosher food in New York. And I saw a Spear sign, and I just walked in. I'm like, I think I know who owns this place. And I ran into you. And I was greeted as if I was family. I mean, I was obviously a stranger just walking into a clinic, and I felt at home immediately. Tell me how you rose to clinic director and what your career has been like in the 3 years you've been there at Spear.
Sure, it's been a journey for sure. So I would say day one on the job, I wasn't sure I wanted it. I wasn't sure if I wanted leadership, but I was surrounded by the right people that helped me get to where I am today. So, I spent about a year and a half as a staff therapist, learning how things operate in the clinic. And after that, I moved up to assistant director for about a year. And recently, as of February, moved up to the clinical director role. And I would say like the major thing that Spirit does is invest in their people. So, we always promote within. It's not about tenure. It's about who's right for the job. And I worked my way up, gaining experience here at 70 Pond. And here I am as director now.
Yeah, I love that. So, I walked into a very busy clinic, a number of PTs working really hard with a number of patients. So tell me what it's like being a staff PT at Spear. How many patients do you see an hour? How long do you have for evals? And what types of patients are you treating?
Yeah, it's a good question. So, in our setting, our expectation is we're seeing about 12 a day, 60 a week. Within the hour, we book every 25 minutes now. So, you could see anywhere between 2, 3 potentially in an hour. That's a recent change. We used to be 30-minute blocks, switched EMR systems as of January. And the major change there was for autonomy. We're trying to make life more flexible for our staff therapists. It was a bit of a struggle to, meet your 60 a week. So having the more slots has helped us. And yes, it does get busier earlier in the day versus, midday, pre-post work hours. But I would say the reality of being in a network physical therapy company.
Yeah. So how do you manage treating patients on the 25? Give me some tricks, because you're talking to a guy with serious ADHD. My head just spins thinking about trying to treat that many patients. How do you manage a schedule like that?
It's a great question. Of course, everyone's strategies are different, although it definitely starts with knowing your patients. There are a few that are a bit more independent, and maybe that gives you more leeway. But, what we're trying to do is, not catch our patients by surprise. Day one at the eval, we're establishing the fact that, all right, if you want to come at 8 a.m., just expect that it may be a little bit busier. If so, we can still schedule that time, but if you prefer a slower time, this is what's available. So we're always transparent as much as we can be when it comes to scheduling our patients. That being said, yes, times do get busier. We do have a team of therapy technicians that just assist with the flow of each patient session. But for the most part, we have, luckily, each clinic is intentionally set up so it's open floor, there's mirrors all over the wall. So we always have our eyes on the patient. And I think that's what allows us to see that volume.
Okay, and what's your best advice to a new therapist who's walking into let's say 2 an hour, 3 an hour? What's the best way to make sure every patient is getting exactly what they need?
I would say ask. Each patient has different demands. Some do want a little bit more one-to-one time, and others may be okay, operating on their own. So my advice to that new graduate would be to get to know your people. It always starts there. If we zoom out from the realm of physical therapy, you know, it's always about the person in front of you and what they want. So even if you were giving a one-to-one session for an hour with a patient, that's not what they might want. So I think knowing what they need is super important. So, again, to that new grad, it's asking the right questions, catering to the best of your ability to what they need, and being transparent, being honest about how things will actually operate.
Yeah, I think that's totally worthwhile. Now, let's say high level athlete comes in or complex patient presentation is in front of you, and they say, "Listen, Justin, this is great. I feel like I need more time with you. I need more one-on-one time." How do you handle that conversation?
Yeah, let's be real, it happens all the time. And we're not looking to sacrifice quality of care. So in those instances, number one, we'll offer time slots, for example, end of my day or beginning or end of my lunch. Allowing that slot to, offering that slot to that patient so they have a bit more time. There's no one scheduled before or after them. One thing we did want to promote was flexibility for our PTs, make it a little bit stress or decrease the stress level
Yeah.
for our therapists. So, one thing we'll also offer is, documentation block. You can use that freely. So maybe I place that before or after that patient. And that's at your own discretion. As long as you're successful, you know, hitting your 60 patients a week, we can also in turn be flexible in that way. Because of course, quality of care is most important.
Yeah, and then walking the clinic that you run, that you're clinic director of, is down towards Wall Street, right? So square footage is at a premium. What do you do with an athlete that needs to learn how to cut, needs to learn how to decelerate, or is working on some higher level athletic endeavors? How do you make best use of your space?
That was my initial question. I walked into the clinic day one as well, just from being in bigger clinics in Jersey where I had most of my rotations. So transparently, like, it's not feasible, for some of those athletes where you do need a bit more space. An alternative offer is, we do offer other services like transitional care or even home care, where we can meet, that patient at whatever facility and, have the appropriate equipment environment to assess those things. But, being full transparent, there are certain things you can assess and certain things that aren't as feasible. So we do our best to, simulate that environment.
Yeah. Now there's, I mean, you make a good point because I love talking about how our clinics are big and open and you have tons of turf. That doesn't really, you don't come by that often in the middle of Manhattan. The space just doesn't exist. And I say that because there is so much we do before, running a 40-yard dash. There's so much we do that doesn't need this massive amounts of space, whether it be drilling change of direction, whether it be working on deceleration or acceleration in small confines, which very often is the way these athletes are working. So I think there's a ton you can do. I love that Spear offers the ability to, hey, I'll meet you on a field, or I'll meet you in your gym, wherever it is you have space to allow for that. So I think that's a great way to answer that. Give me the biggest challenge you have felt since becoming a clinic director.
Biggest challenge I have felt is definitely balancing the time between treating and handling more of the, director roles. So, managing a team, PTO hours, um, just being a manager in general. I still very much love treating and working one-to-one with my patients. So I have less of that. So it's just finding the delicate balance of, all right, how much can I still be a staff therapist, do what I love to do, but still operate a clinic on the business side, which I'm also passionate about. So I would say just tug of war, like where I have to spend my time wisely in both.
A- And so if that's the biggest challenge, what is the antidote to that challenge? How do you solve for that?
The way I solve for that is just playing my week strategically. Maybe there's one day where I'm training a little bit more heavily, and another day where I had a bit more, administrative time and knocking out some of those tasks that I have to do. So just time management, I would say, is essential for what I do.
Yeah, and what's your split now, clinical versus admin? Do you still have to see 60 patients?
My expectations are a little bit different. 36 a week, so about 4 hours treating, four-ish, maybe it's five sometimes. Rest of the day, 4 hours of admin time, but it varies from day to day. Very much so. And a lot of times
And,
I'm seeing a little bit more.
and that's okay. So and that's totally up to you. How many PTs do you have reporting to you?
Right now, we have a team of 7 reporting to me.
Wow, dude, 7 PTs.
Yes.
That's incredible. And so walk me through the ladder of how Spear prepared you to be a clinic director.
I love that question. I think Spirit does a great job of offering that leadership pathway. I think the best way they do that is from day one, they are genuinely interested in, what's your growth path with us? It's on a piece of paper, there's a step by step outline, physical outline of, all right, how do we get there? So I think it's just the right people in this organization that care about your growth and hold you accountable to it. I was very surprised with the structure of how, that growth path looks. And it's not just leadership and, being a director, it's also clinical education or leading a journal club, running a seminar. Everything is very structured. I think that's how things happen for you and how you tend to grow.
Yeah, so give me more of the nitty-gritty of that piece of paper. What are the steps? How long does it take? How'd they choose you to become clinic director?
Yeah, I'd say it's different for everybody, of course. Although, I think it starts with one, your director knowing your goals, and two, showing that you can do your job effectively. We all spin plates as a staff therapist. There's different things we're doing. If we can show a level where we can do all those things efficiently, um, yeah, I would say that's step one. Like doing your job effectively, because who wants to be managed by somebody that's not doing what you're supposed to do
Yep.
at a high level? And outside of that, it's we have a leadership program within the company called SFLP, Spears Future Leader Program. I think that was a huge opportunity for me. It's like an MBA style, year-long uh, leadership crash course. So once you get to that level, which you apply for, get accepted, you have quarterly in-person seminars with the entire leadership team, other applicants and participants in that cohort, learn the ins and outs of the business, not just, you know, business and operations, but also the soft skills and becoming a leader. So I think after that program, you meet the right people and, your name kind of gets out there and you pick up the right skills and you slowly gain more responsibility within the clinic until ultimately you're, familiar with what a director is supposed to be doing.
Now, did you were working in this Wall Street clinic, let's call it, you were working in this exact clinic before you became clinic director?
Yeah, 70 Pine Street, whole career.
Okay, so 70 Pine?
Pine, yep, 70 Pine
Pine.
Street.
Okay, 70 Pine. You got to live and die 70 Pine, obviously. That's seeping out of you. So that's awesome. What happened to the clinic director who was there prior? Like, where do they matriculate to? And what if there's no clinic available for you to become a clinic director? What do you do with this SFLP?
SFLP, yep.
Yeah.
So our first director, when I had first stepped in, he went on to open a clinic in NoHo. And then the staff therapist on the team already became the director. And, this past year, he opened a clinic in on Long Island, where he's from. So that was his goal. So stepped in February. And, your question of what if there are no clinics to open or places to move?
Yep.
Uh, Unsure, because right now it's probably it is the most clinics we're opening at one time currently. So we're strategically expanding, and those opportunities are more abundant than ever. I would say, I was coming in 2021, but before then, mid COVID, I'm sure things were slow. Um, things are, I would say, never fully stagnant. Knowing the values and you know the pathway that we're looking to go as a company, I think those opportunities are going to be abundant.
True Sports Physical Therapy is growing like wildfire. We have 14 locations, soon to be more. We are throughout the state of Maryland. We're in Pennsylvania, in Lebanon, in York, Pennsylvania, as well as in Delaware, in Newark and Wilmington, Delaware. Like I said, so many more practices to come, and we always need outstanding sports physical therapists. Our treatment style is unique. We are one on one with your athlete for 45 minutes every single session. You do the entire treatment, you do the entire evaluation, and they are in state of the art facilities where you have room to run, throw, and jump and really get your athlete all the way back to on the field and better and stronger than they were. We also have outstanding salaries, comp structures, bonus abilities, 401ks, as well as a very strong continuing education offering, including in-house continuing education. And we're looking for you. Now is the time, as we are growing like crazy. Just shoot your resume over to Yoni, Y-O-N-I, at True Sports PT, or shoot us a DM, and we will hit you back. We will get you in for our unique, tried and true interview process and really make a determination that this is the right place for you to grow your career and get your athletes better than ever. We can't wait to hear from you. Yeah, well, I mean, that speaks to Spear's success, right? And it speaks to the vision. So that's awesome to hear and refreshing to hear. What if you're an outstanding staff PT, you're great interpersonally, you just don't want to manage other PTs? What other leadership roles are available within the Spear structure?
I love that question because people automatically think, oh, I have to become a clinic director or assistant director. But yes, going back to the fact that Spear outlines that for you, makes it clear. You could go into leading our manual workshops. We have quarterly manual workshops for all new grad therapists they're required to go to. You could be an instructor for that. You could lead a journal club. If you have a specialty such as vestibular or BPV, you can lead an in-company workshop. A lot of paths you could take. You become a CI. So a lot of clinical education pathways and also involvement in our specialty programs. There's a role for everybody, I would say, depending on what you're looking for.
Yeah, that's really awesome to hear. And then talk to me about students at Spear. Where do they play in? How often do you get them, et cetera?
Yeah. For us, probably about one or two students a year. We only do it if someone
That's
on our
per
team,
clinic? Is that per clinic or per therapist?
per clinic, at least that's
Okay.
75. It's a little bit different depending on what the school needs. We have a great relationship with Hunter, Columbia, so we tend to see more of those students, but we don't take students unless someone on our team is interested in it. Like we would never force it upon somebody. So if someone has a passion for mentorship, awesome. Let's get you a student and allow you that mentorship opportunity.
Yeah, that's really awesome. And so you didn't do a rotation at Spear while you were at Rutgers, did you?
I did not. Yeah, all in Jersey.
So how'd you find Spear?
It's a funny story, actually. It was like 2015. A friend of mine was working at this Spear, actually.
70
And
Pine.
75, yes. Um, that was actually a few years before 75 had opened. He was at a Spear, and I remember seeing him dressing up with his team for Halloween. I was like, all right, this seems like a fun place to be. And following him throughout the years, 75 opened in 2017, and he moved over to that clinic. And when the time came, April, year of graduation, I was looking around trying to see where I wanted to work, and I thought of Spear. So, fortunately enough, there was a virtual career fair for New York outpatient clinics that I decided to attend. And Spear was my first interview. And, knew right away, like, all right, this is the place I want to be.
Because why?
The culture. I think that post really impacted me, like seeing how much fun they have, and being a close friend that I trust, sharing his feedback on his experience, but also just the excitement of working in New York. Now that was always a dream of mine, being from a like more suburban town in New Jersey. I definitely wanted to come here and do random things like this. You never know who's going to walk the door, and here I am on a podcast with you. The
Yeah.
opportunities are endless.
Yes, yes. Typified by one schmuck walking into 70 Pine and, and it just turning into this outstanding podcast. So, okay, so you come to Spear and you're struck by the culture. Now, what do you do as clinic director to make sure that you continue to grow that culture?
And I love that question too. A lot of great
Full
questions.
of them. I am full of them. This is all I do is ask questions all day.
The right ones, the right
Yeah,
ones.
I guess
So, I
so.
mean, I think that was my main passion for wanting to become a director. I have a vision for the culture I want to set. Like I'll show you this frame. When I first stepped into the role, my team made this for me. It says Coach J.
Love it.
So, I love basketball, and you know, I always thought that coach role would be awesome. Combine that with physical therapy, my other passion. I think having a true team mentality where we can communicate openly, all support each other, uh, you know, hang outside the clinic is a plus. Luckily, all of us do get along to that level, but just having that team mindset, team oriented connection is the culture I wanted to set here at 70 Pine.
Well, I mean, it's clearly working. And so now let me ask you two questions. Let's start with marketing. How do you then become patient facing? How do you drive more business to make sure that all of your 7 PTs, that is so many PTs, that 7 PTs have a full schedule with the type of patient that they want to see?
I'd say it's partly, I'd say fully your role with the support of, internal structure within the company. So as director, you should be networking with doctors and, you know, depending on the location, attending certain events and having a booth set up at, whatever event is around, spreading the word like that, cold calls, dropping into random buildings, flyers. So, boots on the ground type of marketing.
How do you
And
structure that? How do you, that falls on your plate to do that for 70 Pine?
I would say it's part of your responsibility of, again, building the business, making connections. It's not as if it's required, although, I want to be successful. So that's how I'll do. I'll do whatever it takes. Um, but we do have the support of a physician relation team, and that's our structured team within the company that is in constant communication with doctors, building our network, meeting new doctors in the city. Having solid referral sources is super important for us, and having the right ones.
And do you find that you get a majority of your referrals from physicians?
I would say it's a bit of a mix. We are ground level, luckily, so we do get a fair amount of walk-ins. However, most of the referral source is
Myself
going to.
included. Yeah.
I love it. I love it. Most of the referral sources are going to be doctors that we have formed a relationship with.
So that's amazing that you're able to do that, especially as in network. I find it in Maryland. I mean, we're in Maryland, we're in Pennsylvania, we're in Delaware. I take a different approach. I find I strike out more with docs than I do with coaches, than I do with athletic trainers or strength coaches. It's hell. Like when I started this thing, I started it in Baltimore City. I was at Lululemon every weekend doing workshops. I was at Under Armour. I was everywhere except doctors' offices because doctors' offices own their own PT spots. I gotta imagine like HSS or Cornell or
Yeah.
whatever big hospital, right? Montefiore, whatever big hospital systems are throughout New York City, they have their own PTs. So why do they care about Justin Lugtu on 70 Pine?
Yeah. Yeah. It's true to a degree that these doctors already do have a PT in office or an established relationship with another
Yeah.
therapist within their network. So I think it just goes back to how strongly our leadership from 1999 has been. from 1999, we've been making these relationships. When the company first opened, Dan and um, they were boots on the ground forming these relationships, and directors before me. I think it's just the work put on in the early years that have really been paying off now. We established relationships early on and have maintained them. I think we're structured with maintaining relationships, and that's how we've been able to, we could build solid
Continue to
referral
build on
sources.
those. So that's awesome. Is it to the point where Dan hands you like the Bible of like, hey, here's Dr. So and so, here's his birthday, here's how many kids he has, here's the last time we talked to him, you need to follow up this amount of times? Or is it more of a crapshoot?
We do have, sort of a site where we can track certain things and have quick notes on certain doctors. So, at your own discretion, almost like a Facebook wall to a degree.
Okay, it's there if you want to use it, and to leverage it. Is there any streams of revenue or referrals that you've created outside of that? And how do you go about doing that?
To be honest, it's mostly word of mouth around here.
There's just so
Working
many
with friends
people.
and family. There's a
They're
lot of
just
people.
Yeah, there are a lot of people. Okay, so you're doing tons of word of mouth. Are you doing, when you say you're putting up a booth or things like that, tell me what types of events those are and how you're getting your foot in the door for those.
Yeah, I personally haven't done it, so I can't speak fully to it.
You got to do it
Although
this week, dude. Put that on your schedule.
I
Tell Dan I
would love
said to put
to.
that on your schedule.
um, you know, for example, we had a clinic open in Paramus, New Jersey, so that's a bit of a different feel from the city. So let's say they have like a local event going on the weekend, they'll be there,
Yep.
something like that. Or for example, the New York Marathon, we tend to volunteer for that, have a little booth set up for recovery. So getting involved in assorted events, whether it's at a local level or more grand level.
And then how does the staff PT at Spear, how are they incentivized to be at those events? Do they get paid for those events?
For those, again, unsure because I haven't personally done it. The incentive, I would say, is lies on the director. I think it's super important to establish a team goal. For a new clinic and we're opening up in this area, like, hey team, let's get to work. Let's build up our clinic. Let's put our names out there. And I think that's what incentivizes. I think more importantly, what Spirit also wants you to do is not just work for the business, but work on your business. So it's also putting your name out there. We want our therapists to grow personally and build up their own network and make a name for themselves. That's one way.
Yeah, that's a great way. When do you guys decide I'm ready, I need an eighth PT?
Depends on clinic demands. So of course the seasonality throughout the year. We want to make sure the patients that are waiting at the door can be seen. So I would say it's a more of like a patient demand based on the past years, knowing when we expect it to be busier, higher volume in the clinic.
Do you have a benchmark of what those numbers need to be? Like, hey, if we're sitting at this percent of capacity, we need to bring on another?
We do to a degree. Yeah. If again, I would say it depends on volume. So if we're
Yeah.
seeing a clinic in a busier part of the city, we'll know that we need to staff a little bit more. And this is when, so, we plan as much as we can for that. I'm not too involved in the budgeting process. Of course, I'm newer to the role, but to my understanding, you know, previous years are a big factor into how we decide those things.
Okay, so say you're 7 PTs plus you, 8 PTs, you guys are functioning at 85, 90% capacity. You can't get your post-op patients in, you need to hire a PT. What is the structure of that process?
Mm-hmm. So when a new patient wants to come in, we do have a call center team that will field those calls.
Are they
So, we
American
check
based?
American based. Yeah.
Oh, wow.
Better. Thank
Okay.
you.
Okay.
Yeah. So, of course, we'll consider location and availability. So that's also why we're trying to expand in the right areas is for this exact issue. One clinic's getting too busy, this clinic's opening up and they'll have the space to see you. Um, we always book an hour for our evals, first initial evaluation. So that can also be a factor in how hard it is to get a patient in through the door.
Yep.
So one thing we'll offer is, all right, you can get your initial evaluation in here and then, be seen at this clinic that's a bit more convenient for you. But I would say our answer really is just strategically opening in the right areas and making sure that we're maintaining the culture when we do open those clinics.
Okay, but talk to me about 70 Pine. So 70 Pine is at 90% capacity. You want to bring on a new therapist. Who interviews them?
Mix of a couple people on the team. Myself, we do have a recruiting team that they will be speaking to. So I'd say they will probably be speaking to about either 1 to 3 people.
Before they come in. Okay, do you bring them in to shadow for a day? How do you gauge their clinical acumen?
We do.
How?
So we'll reach out to the candidate, have them come in for a shadowing opportunity, and that's going to be 3 4 hours. 3 4 hours in the clinic, on the floor, talking to patients, PTs, maybe getting involved here and there, showing an exercise. I personally love to run them through some clinical scenarios, case studies, see how they respond to that. But important that we're getting a feel for, how they communicate with the team, with patients, and do they have a basic understanding of, anything clinical that we can throw at them.
Okay, what is the worst interview you've had in the last 5 months?
Oh man, that's a good question. I would
Don't
say
say their name, Justin. Do not say their name. You can tell me the
definitely
school.
not,
It's
definitely
probably
not dropping a
Maryland.
name.
Yeah.
No, it's not even that bad. But I was with the PT and we went out to the floor. I had a patient at the time, so I said, "Hey, go show him some, T-band external rotation." And they just start going like some crazy band movement, and I'm like, "Whoa, whoa, whoa. You don't even understand that basic exercise." So that was a good
And and
example.
they've been working for you for how long now? Did you
Oh, that
hire
was
that?
it.
You did not hire that person. Okay, I'm just checking.
No, we have to defer that one.
Okay. So defer. I like it. Not reject, but defer. Okay, that's fair. But I think you make a good point, and I think it's worthwhile to the new grads that are listening, or even the students that are listening. Is I see a cardinal sin that people make when they come in an interview with me is they get way too fancy. It's like all you asked for was T-band external rotation, and they felt the need to hook a band to an ankle or something ridiculous, or put them on a BOSU. When it's like, what is the point of the exercise? Don't get too fancy. John Wooden, basketball coach, always used to say, don't be fancy, just be good, right? Just make sure you have those basics because I think that's how they really strike out. Hey guys, quick pause and a quick shout out to this new masterclass that we just launched here at True Sports Physical Therapy. Myself and Dr. Tim Stone put together a masterclass of ACL rehab, and we call it From Table to Turf. And the reason we call it that is because it's going to teach you exactly how to get your athlete all the way from post-op day one with the nitty-gritty of regaining all of that range of motion, with the tips and the tricks that we use here at True Sports Physical Therapy that gets our athletes better, faster, and stronger. And that's early. And then how do you progress that athlete all the way onto the field with a ball in their foot or a stick in their hand or whatever their sport is, and teach them how to accelerate, how to decel, how to change direction, all the mechanics that go in there. What drills do we use to get our athletes exactly where they need to be back on the field and even better than before injury? And I want you to sign up for that class now. You can find it on our website. You can shoot us a direct message and just say, hey, send me the course. It's right now on sale, so make sure you sign up now. It is fully accredited to get you all of your continuing education hours. Sign up for the True Sports Masterclass ACL From Table to Turf. Thanks, guys. For sure. Now, what is your incentive to add more staff PTs?
My answer to that is really like, at the end of the day, it's a business. So it's finding that delicate strike of, of course, you're seeing higher volume. That's good on the business side, but how is that impacting quality of care? So, just like every other business, you do have certain targets you're looking to hit. So my goal is really to hit those targets at with well avoiding the expense of sacrificing quality of care. Now to me that's forefront. So it's always striking that balance, I would say. It can be difficult at times, I would say, but my incentive really is that my team is happy and they feel like they can do their job effectively. Do they have the right tools? Do they have the right resources? And on the business side, are we being successful?
Okay, so when you sit down for your annual review or your quarterly review, what metrics do you and Spear leadership look at to measure, hey, Justin's doing a good job as a clinic director?
Mm-hmm. A few things I'd want to, not be fully transparent about, of course, but I would say generally, again, obviously you're looking at the number of visits per year and how much revenue you're generating. So I think those straightforward things, but also what I've really enjoyed as I stepped into the role is how much we are measuring happiness, quality of care, retention. I think our big focus this year is how can we make our team happier, get rid of any barriers to, you know, hitting our targets, anything like that. And again, just making sure that our team feels like they have what they need to do their job effectively.
Yeah. Now the first half of your answer, I think, is worth diving into because what we call it at True Sports is profitability. And so it's awesome to have 7 PTs working for you. It's not awesome to have 7 PTs working for you if you have a caseload of that would fill 5 PTs because now your profitability is way off. You're losing money in that instance, right? So I think PTs need to get comfortable with understanding what goes into profitability. Happiness is really important, but I can't have a therapist that's really happy and not profitable because there won't be a clinic next year for them to be happy in if it's not
Yeah.
profitable, right? So it's like it's really like narrowing down your focus to the management to say here are the KPIs that we need to be profitable. We need to see this amount of patients. Your staff, need to be making this amount of money for the entire thing to keep rolling. On top of that, let's put in happiness because that speaks to your retention. That speaks to your level of engagement of the therapist, right? And that will ultimately speak to your profitability. Like if therapists are leaving left and right, you're going to lose. Your profitability is going to come down because you're not going to be able to replace them. You're not going to be able to have those visits seen, right? So it's really layering those. It's something that we're working on really hard here at True Sports is not being scared of the P&L, of your profit and loss statement. Like I went a long time working for other people and even working for myself when we would dance around this idea of here's how much a patient visit is worth, here's how much it costs us to provide that level of care. Those numbers cannot get out of whack. Otherwise, no one's happy. The company's not happy. The therapist isn't going to be happy because they're going to be working a pivot. They're going to be working somewhere else, right? So it's like wrapping your head around those numbers is something that we've worked really hard here. I love that Spear speaks to this with their leadership. I mean, you described it as a mini MBA where they're teaching you the nuts and bolts of how do you run the finances of a clinic, and I think that speaks to that, right?
Yes, 100%.
So I think there's a lot there. I love that they do that. I mean, one of the better conversations I've had with Root was on a plane to Korea, simply dissecting how do you look at a profit and loss statement? Like, what are the metrics that we care about? How much does a clinic director, does a staff PT need to understand, need to know, so that they can work hand in hand and we don't just turn a blind eye to the numbers. I think we get in trouble when that happens. So I love that Spears kind of doing that to begin with. What do you wish you knew coming out of Rutgers that you now know having been through Spear?
I wish I knew how much the business plays into what we do, especially in this in-network outpatient setting. All of the numbers, finances, like I wish I learned more of the business side of things in PT school, honestly. And I'm learning that now as I go.
What kind of resources do you use outside of Spear that are easily accessible to anyone listening to this pod?
Nothing fancy. you know, audiobooks, podcasts. I subscribe to, the management tip of the day, and little things like that where it's just spread throughout my day is also how I learn. And just staying hungry. I think when I meet the right people, I will 100% take the opportunity to meet and pick their brain. And that's, again, going back to the reason why I wanted to be in New York. You get that opportunity to spontaneously run into people that, you learn a lifetime from.
Yeah,
So
yeah,
just
that's awesome. Yeah,
yeah.
and by the way, like you have that New York bias where it's like you think it can only happen in New York, but wherever the hell you're from in Jersey, I guarantee you there's a business owner that was walking in with shoulder pain that you can glean a ton from. What kind of audiobooks are you listening to? Give me specifics, Justin. Don't hold out on me.
I think they're more like, not technically business oriented, but I love Jocko Willing.
Who
I
doesn't
think
love Jocko Willink?
Extreme Ownership,
Yep.
Goggins, of course, both of his books I read through. I think those are two like huge books that changed everything for me. Shoe Dog by Phil Knight is another huge favorite of mine. I love Nike
What's
and basketball, of course, but
so I hear that. What and I loved Shoe Dog. What was your big takeaway from Shoe Dog?
and from Shoe Dog, I would say it's what's going to make you successful is you know your passion for pursuit. And I also think you know you come across that big idea when you least expect it. So don't be afraid to take chances. He came up with the idea of Nike from a random month, however long trip, just traveling the world, and you know came up with that idea. So I hope the same for myself.
Yeah, and he freaking ran with it just like you're running with it. So you're definitely embodying that. I definitely took away that lesson. I came away from that book thinking, how does someone start or run a multi-billion-dollar organization and he's actually that good of a dude? I mean, he was
Yeah.
I think he screwed over one guy he talks about, like his salesman that he sends to the East Coast.
Oh
He
yes,
screws him
yes.
over, right? And like he can't sleep because of it. I have a hard time believing he's that clean, but it's really impressive that he's even close to that. I think it is nuts that he was able to be that successful. But it was a great takeaway that sometimes good people, you don't have to be a dick, right? I
100%. You don't.
I
You
would
really
I would
don't.
I would sum that up. And I think like when I walked into 70 Pine, I said the same thing about your CEO. It's like it is astonishing that level of success has not gone to his head. It's really incredible. It's a great life lesson. Did you read? You're too young to have as many kids as
Yeah.
I have, but I love Jocko's kids books. They are awesome because they talk about some of the struggles that I see as I have younger generations of PTs or younger PTs coming in that are coming with a totally different mindset that I have as a ravenous entrepreneur. He talks about in his kid books of like building toughness and resiliency in younger generations. And I think there's such a divide between millennials and now Gen Zs and whatever was before millennials is boomers before millennials. But there's such a divide, right?
Yeah.
And how do you bridge that gap and how do you educate around that? I think are totally worthwhile. What do you say? The management minute,
The management tip of the day.
the management of the day. Who puts that out?
Yeah. Let me look real quick, but
Yeah.
it comes to my email right there for me to view every day. And, some of them are more relevant, some of them are not, but, a quick other thing to look at. But that's out from Harvard Business Review.
Okay. Nothing bad ever came out of Harvard. So that's awesome. No, I
Arguable.
haven't. Yeah, very arguable. I have enjoyed the HBR series. Like they put together a series with case studies that are business related that I have found to be awesome. So I think that's an awesome recommendation. So I appreciate you finding that so everyone can kind
Yeah.
of learn about that. Talk to me a little bit about Justin Lugtu, the person. Okay, we're gonna because you've been how young are you?
I'm 28.
28. You're a freaking child. So clearly wise beyond your years in a serious management organization. So I would love to learn a little bit about what it is that makes and some of the lessons that we can hopefully pull from that. How many siblings do you have?
2 siblings. So I have an older sister 1 year, younger sister about 2 years, middle child.
And what are they doing?
We're all medical. So my older sister's a pharmacist, and my younger sister just finished PA school. She's also working in New York. So
Hell
it's,
yeah.
yeah,
So it's in your blood. I love that
my
you
blood.
include us. I love that you include it in medical, because one of my good buddies is he is an orthopedic surgeon, and he calls me medical or orthopedic adjacent. He won't even call me like part of it. Yes, it's so degrading. So I appreciate you
Yeah,
elevating that. Thank you very much. Okay, so what lesson did you learn in your upbringing that you bring to work every day?
man, I appreciate you asking first of all, but I think number one thing is don't let yourself get boxed in. Growing up, boxed in constantly, you know, obviously that stereotype, like, oh, I'm that Asian kid, it's like still 5 foot, not growing much in high school. So
I met you
pouring
in
into
person.
being,
You're bigger than 5 foot.
I grew a little bit. I grew a
A
little
little.
bit. Thankful for that.
Yeah.
But, I constantly had people like tearing away my confidence. And, you know, I feel like I knew I wanted to be a leader in some way, but was surrounded by the wrong people. So, here I am, post PT school, first job, surrounded by the right people. And even before that, of course, the PT school had some great friends, but, not being afraid to live up to your truth, I would say, you know, know yourself. Don't let anybody else tell you what you're supposed to be, and pursue it with authenticity. I think the way I lead is super authentic, keep it real with everybody. And that's what's made me successful in my eyes.
Yeah, and that surely comes across. That came across when I first met you. I'll tell you when else I really realized it was in those 11 minutes that I was inside of 70 Pine. My first interaction was with one of your techs, I think. She gave me a tour of the clinic as if she owned the clinic. And then she said, let me see if our clinic director is available. You might have to wait a couple minutes, but her reverence and her respect for you, her reverence and respect for me, a rando walking in, was clear. And by the way, I mean, I'm sure she has her own backstory and life story, but your ability to support that and ingrain her with that culture and respect, I think that speaks so highly on the company. It speaks so highly on your leadership, despite the fact that you're only 28. I mean, it's really amazing. And leading a team of sports PTs, it's also crazy to hear a guy of your age with 3+ years experience as a PT, how far this profession has come. So I've been a PT for 15 years. When I came out, dude, we were lackeys. Like whatever the physician said, that's what we did. They would check ultrasound, we would do ultrasound. They would check electrics, and now I'm talking to guys who are 28 years old, who've been a PT for 3 years, who refer to themselves as leaders, can talk and articulate on good leadership, on the way they're trying to model culture. It's amazing how far this profession has come. What do you think the next step? How do we take this profession to the next level?
To the next level, I think it starts in PT school. You look at chiropractors, and I think they learn a lot about the business side and how to sell themselves, or at the very least, advocate for the profession. And they're on TikTok and they know how to expand their audience. I
Yep.
think you still go on the street, you might go like 4 for 10 in terms of do you know what physical therapy is.
Yep.
So advocacy is huge, I think.
So how do we actually do that? Because I think you're totally right. I was going to mention Kairos earlier. They're awesome at that. They're awesome at understanding business, and they're awesome at marketing and marketing know-how. How do we advocate for the profession?
I think it simply starts with an elective or a course in PT school that offers that mini MBA education and bring your awareness to the entrepreneurial side of things, and making sure we're all equipped with that elevator conversation of what is physical therapy and how can it benefit you. And you know obviously getting more people involved with the APTA, and you know pushing for what's right for the profession. Of course, that's a age-old question of how we do that, but we do need more of that.
We definitely need more of that. Why do you think it's not in the graduate school curriculum?
It's a great
Because
question.
it's not just Rutgers. I also went to a state school. It's not there. It's not. I mean, in so many, even universities and academic institutions that tout themselves as number one in the country, they are not getting that type of education. But what is preventing it from being inside the walls? I have an idea, but I'd love to know yours.
Yeah, yeah. I mean, of course, I think it starts with the staffing of the school. That's variable across the board. However, I just don't think people see that as a root in physical therapy right now. I think we're a couple of years behind Cairo, just as almost like OT is starting to become a more doctorate level now. We're trailing Cairo where we're starting to realize, oh, I can go on Instagram and make a name for myself. And that's we're seeing like the start of that.
Yep.
So I think a couple of years down the line, more people will have that mindset and see, what is possible in the realm of physical therapy.
Yeah, I think I totally agree. What I was going to say was exactly what the first thing you said was, which was the staffing of PT schools. I was surrounded by academics. I was surrounded by people who had not run their own business to any measurable degree that work for the institution. And so when you work for a university, you don't care about marketing. You don't care about a profit and loss statement.
Yeah.
You may or may not see elite level athletes. That's always been my pet peeve. As I got out of school, dude, I was ready to maybe rehab a total knee, but I didn't know how to teach a box jump, let alone change a direction and deceleration and
Yep.
all those fancy things. So I wish these universities would include more schmucks like me and you who could teach the next generation of PTs what is it like in the outpatient ortho world. I am fully aware that it's a small subsect of what it is that PTs do, but it is a wildly popular subsect, and I
Yeah.
think we are underutilized. Like, if I could tell you how many emails I've sent to institutions saying, dude, I would love to just come in and teach. I just want to talk to the next Justin Lugtu and tell them about some of my experience or the mistakes I've made, because God knows I've made a million of them. I wish they would give us a little bit more of the opportunity. That's why I love bringing students in. So, um, as the great Colin Thompson would say, I digress, because I could stand on that soapbox forever. But I think it's
Too.
worthwhile. Justin, I'm so impressed with what you've done at Spear. I'm really impressed by Spear. Obviously, I knew a lot about them before I walked into 70 Pine, but you are a great representation of what that company is doing. And your clinic, like I said, from the front desk to the tech to the other PTs, they obviously value what you do. So you're doing something really special. And your time is insanely valuable treating that many patients an hour. So I appreciate you sharing a quick bit of all it is that makes outpatient sports PT awesome. So thank you very much.
Thank you. And I want to quickly add too, I mean, on your end, um, that staff member that you talked to came to me yesterday and was like, "Hey, who was that guy that came by a couple of weeks ago? He's super nice. Like, did you ever hear back from him?" I was like,
Who
"Yeah,
are
it
they
was
talking?
Tony.
Who are they talking? Oh,
Talking about you." Like,
yeah.
hey, I was like, he's super nice. Knew I was trying to go to PT school and was being super helpful. So, I mean, kudos to you too. She remembered that interaction just as much as you
Sweet.
did.
I appreciate it. Well, she better start working for True Sports in about 5 years. Why don't you tell her that?
We'll
Because
see. We'll see.
she's obviously a stud. Justin, tell this entire audience how they can find you, best ways to reach out, and things of that nature.
Come to 70 Pine Street.
70 Pine.
I
He's
mean,
always at 70 Pine.
if you need physical therapy, come see me. But I'm on social media at JAY_LUG. That's my personal account. I did have an old Instagram physical therapy account that still exists, but not posting on that. But yeah, I mean, really, this is my passion right now. I want to make 7 Pine Street one of the most successful clinics at Spear. So, my Instagram email is jlugtu, JLUGTU at spearcenter.com. Shoot me an email if you have any questions or, would like to learn more about how we operate here.
I love it. I love it. I love it. Anyone looking for a job, reach out to Justin. Anyone looking for outstanding rehab, 70 Pine. And Spear is such an outstanding institution. So that's really awesome. Justin, thanks for being here. Thanks for sharing your wisdom and knowledge. We'll do it again soon, man.
Thank you, Yoni. I really appreciate it. It's nice talking to you.
Absolute pleasure. Thank you, everyone. As always, you can share your feedback, True Sports PT on Instagram. Let me know what you loved about this interview. Let me know what you wish I would have asked Justin, and we'll bring him back on and we'll run through those questions. Thank you guys so much for listening. Bye-bye. Bye-bye.
Thank you.